What is up, everybody? I just wanted to scare you coming out of that timer. What's up? I'm Anthony LaRubio. High five for showing up on a Monday morning. I am the founder and the head coach here at Recal Training. I'm excited to be with you this morning. We are going to do some breathwork training, a continuation of going through our BASE foundations to all of our breathwork training. Today's session is focused on the S in BASE, which stands for strengthen respiratory muscles. So today's training session is going to be all about respiratory muscle strength training. As a reminder, BASE as a whole stands for all the areas that we focus on in our breathwork training programs. B, better breathing mechanics. A, adaptation protocols. S, strengthen respiratory muscles. And E, elevate your performance. These are the principles that we've used to help train hundreds of athletes to climb some of the highest mountains in the world and finish some of the most grueling ultra marathons. So, whatever your goal is, BASE is the foundation from a breathwork training standpoint that can help you get there. So, get yourself ready to strengthen your respiratory muscles in today's 25-ish minute training session. We'll begin as we always do in a seated position. So go ahead and make your way there. But on your way there, there are a couple of pieces of equipment that you can use today. If you have a Buteyko belt, something that could provide resistance to your breathing that goes around your waist, something like this, go ahead and grab that. If you have a sports mask, an altitude simulation mask of any kind that can go on your mouth like this. If you heard me, I said that can go on your mouth like that and resist the air as you breathe. Go ahead and snag that puppy. And lastly, good old fashioned balloon, because we're going to throw an exhalation party by the end of today's training session. We're going to blow up some balloons. Okay. Hopefully by now you've made your way to that seated position. We are going to begin today's session as we always do with a little nose unblocking exercise. Then we're going to do a little breath assessment called location of movement. But to begin, sit up nice and straight in that seat. Relax your shoulders and your arms down to your side. With me, go ahead and take a normal breath in, normal breath out. Pinch your nose, hold your breath. Simply nod your head up and down. You're holding your breath. In effect, we're clearing out our nose. Stick with the breath hold for 3, 2, 1. Release. Breathe in through your nose immediately after. You might already notice more moisture in the nasal cavity as we start to clear that out. Breathe normally. Once again, inhale through the nose. Exhale through the nose. Pinch and hold. Gently rock your head back and forth. Stick with it. We're here for 3, 2, 1. Release. Breathe in. And breathe normally now. We're going to do that one more time. I'm going to sound like a broken record for those that are very used to me saying this, but every time you do nose unblocking exercise, you're holding your breath, pinching your nose, the nasal cavity starts to create nitric oxide, which is a gas that helps to dilate the blood vessels and helps with gas diffusion, getting oxygen into the bloodstream. This is what we're bringing into the system during this exercise. One last time. Inhale. Exhale. Pinch your nose, hold your breath, rock back and forth. Stick with it for 3, 2, 1. Release. Breathe in. All right, we have cleared out the system. Next up, a little breath assessment for you. I'm going to also sit in that chair. I'm going to guide you through something called LOM, location of movement. What this will help identify for us is the location of the movement that happens when we breathe. Actually, I'm going to hold off on sitting because I think I can do this standing. Go ahead and sit. I invite you to place one hand up on your chest, one hand on your belly. Look down the front of your body and observe where the movement happens as you breathe normally. We're here for about the next 10 or so breaths. Don't look at me. Don't try to copy my breathing. This is about you right now. I feel like I'm being watched. Where do you notice the movement happening? Which hand is it happening in? Do you feel like there's vertical movement up and down? Do you feel like there's horizontal movement, front and back? Do you feel like there's movement to the sides? Maybe even 360 degrees around the rib cage? Take the next 2 breaths and really focus on where the movement's happening when you breathe. Okay, good. Go ahead and drop your hands now. Where we want the breath going is in zone 1. That's the zone that's lower belly area that engages the diaphragm with each and every breath. So now place one hand back on the belly. Don't worry about the hand on the chest. We're going to do a little targeted breathing exercise now to focus on breathing strong into that lower belly area. So for the next 10 breaths, I want you to breathe deeply through the nose and feel the expansion outward, maybe even to the sides, into the lower belly with each and every inhale. Next 10 breaths from a seated position here. You might get lightheaded. If you do, and that's uncomfortable to you, just slow down your breathing. All right, here we go. Inhale deeply through the nose. Exhale passively through the nose or the mouth. Good work. Just 5 more breaths. These last 3, make them the deepest, fastest breaths yet. Really pull the air deep in the lungs. One more breath. Everybody, deeply in. Relax. Drop your hand, shake things out. Shake out the shoulders, move the body, whatever feels right. If you're feeling a little bit fatigued in that lower belly, that's good. That means we're engaging the diaphragm. We're doing a bit of strength training for the diaphragm. The next phase of this exercise, we're going to graduate now. The next phase of the exercise is adding, if you have it, adding that Buteyko belt or whatever resistance band belt that you might have. Maybe it's a back brace that just has a little bit of that action to it. If you weren't looking, that action was resistance. It's got some flexion. If you're curious where to put this belt around your waist, half of it should be just over the bottom edge of your front rib cage. Half should be above it. That's a good placement. That way, when we breathe and we expand the rib cage with each and every breath, we're going to be going right against that resistance. The 2 muscle groups we're going to work here for this particular exercise is that diaphragm, that dome-shaped muscle beneath the lungs, but it's also going to be your intercostal muscles, the muscles in between each rib bone in your rib cage. We're going to breathe deeply through the nose for 10 breaths yet again. Then we're going to do another set of 10, this time with 1 nostril blocked. Okay? Again, this is from that seated position. I'm still going to stand because I feel like I can coach you from this position. All right. Sitting up nice and straight. Take a natural exhale through the nose. And now inhale deeply through your nose. We don't have our hand on the belly, but hopefully you can feel the expansion in the belly. Exhale passively. Deeply in. Exhale passively. 8 more on your own, whatever pace works well for you. And for those that don't have one of these pieces of equipment, no problem. Just have your hands here. Just breathe deeply into the belly. Not a big deal. 5 more. 4 more. 3 more. 2. The last one. Exhale passively, just let it go. If you feel lightheaded, we're going to do a little slow breathing just to counterbalance the pH of the blood. Take a normal inhale through your nose for 6, 5, 4, 3, 2, 1. Exhale 6, 5, 4, 3, 2, 1. Again, inhale. And now exhale. Okay. Hopefully that reset the biochemistry of the blood. Hopefully we feel not as lightheaded as we did before. We're going to do this all one more time. Again, if you have the SportsMask, throw that on. If you don't have a SportsMask, grab your poor man's SportsMask, block one nostril, and that is how we're going to do it. I'm not even going to make a drug reference here. Okay. Breathing, 10 deep breaths, one nostril blocked. 3, 2, 1, go. Deeply in. Exhale it out. Deeply in. Exhale it out. 8 more on your own. Find your pace. This is probably going to be a slower pace than the previous sets because we've added the air resistance. It should take longer for you to fill up your lungs with each and every breath. Getting high on our own supply of air. I swore I wouldn't make a drug reference. Keep going, everybody. 5 more. Really feel that rib cage expand with each and every breath, pressing out against that resistance belt, pulling the air in against the air resistance of your nostril. If you need to, you can obviously switch nostrils. One is typically more clogged than the other. I just found out my right one is way more clogged than my left. Let's go. 2 more breaths. Last one. Pull it in deep. And exhale. Let it go. Slow breathing once again with me. Inhale for 6, 5, 4, 3, 2, 1. Exhale. 6, 5, 4, 3, 2, 1. One more time. Inhale, nice and slow. And now exhale. All right. Nice job. We've got one more variation of this exercise. I am going to sit down for this one. Therefore, I'm going to just adjust the camera. Bear with me. Hi. So, what we're going to include now, we're still going to do the air resistance. We're still going to do the physical belt resistance against the rib cage. And now we're going to include rocking forward over the legs and rolling backward back up to a seated position. If you have any sort of low back pain or you're limited in some way physically, you don't need to do this type of movement. I don't want any injuries out there. But when you exhale, you're going to rock forward. And then when you inhale, hopefully you feel the expansion happen against the top of your legs. And that propels you up forward back into the normal seated position. One more note, when we rock forward, before we roll back up, we're going to pick the head up first as we block one nostril. Head goes up, then we continue up to a seated position. This is called rock and roll breathing. Let's begin. Exhale, rock forward. Block one nostril. Inhale, head comes up, rest of the body follows. Good. Exhale. Block the nostril. Inhale, head first, then body. Good. You're going to do 8 more. Stick with good form, very controlled movement. Focus on each and every breath. A full inhale. Feel the expansion in the rib cage pressed against your legs. And then the exhales are just passive as you melt back down, keeping a straight back, controlled head first, then body. Let's go. 2 more. Last one. Back up to a seated position. Relax, breathe normally. If you want to, you can join me in slow breathing on an inhale now for 6, 5, 4, 3, 2, 1. Exhale. 6, 5, 4, 3, 2, 1. Inhale. And exhale. All right. That, my friends, was rock and roll breathing with resistance on the rib cage, air resistance on the nose. That helped to train our inspiratory muscles. Again, the diaphragm and your intercostal muscles. Now we're going to move on. Sorry, my nose. It gets sniffy and wet and all that sort of stuff. Now we're going to move on to an exercise that will help train the expiratory muscles. These are your exhalation muscles. This is primarily your abdomen as well as your inner intercostal muscles. The outer intercostal muscles are used on the inhale. We are going to take the band off because, quite frankly, this would help us exhale. Again, from a seated position, this exercise is called balloon breathing. So go ahead and grab your fancy balloon. We are going to blow up this balloon as many full times as you can in 1 minute. I'm going to show a timer on the screen. Just bear with me. As you can see, timer on the screen. Let me switch up that background. There, that one looks better. Whoops. All right. So, as many times as you can in 1 minute, take a full breath in, full breath out through the balloon. We're starting in three, two, one, go. Each and every breath, I want that pressure to come from your abdomen, squeezing down. Not a lot of rocking back and forth, but just squeezing down into the space. Really empty your lungs with each and every breath. Good. We're halfway through. Come on, everybody. If you're feeling lightheaded, stop. Take a few normal breaths, even slow breaths, just to kind of recalibrate the system. 10 more seconds. Come on, get one more. All right. That was 1 minute. We're now going to do 1 minute of slow breathing. Inhale on the count of six, five, four, three, two, one. Exhale. Six, five, four, three, two, one. Inhale once again. We're doing slow breathing just to help offset the gas exchange that we just completely threw off with all these strong exhales. And now exhale. Six, five, four, three, two, one. Inhale and exhale. Inhale and exhale. This will be your last exhale. Just let the breath go. We're going to do one more set. Once again, for 1 minute, as many times as you can, blow up that balloon as fully as possible. All the pressure coming from the abdomen space, really squeeze down, collapsing that thoracic cavity to get every last bit of air out and into the balloon that you can. Hopefully, you picked a big enough balloon. All right. Deep breath in through the nose. And we begin. Keep going, everybody. We're almost halfway there. You can do it. We're having a breathing party. 15 more seconds. 10 more seconds. Come on, get one more. And that is time. We are slow breathing for recovery. Inhale as slow as you can. I'm not even going to guide you on this. Inhale on whatever slow pace makes sense for you. Maybe that's 10 seconds. Exhaling and letting the breath go. Just relaxing, almost like this is a meditation. Slow, deep inhale. Passive and relaxed exhale. Just notice any changes that you feel in the abdomen, in the diaphragm, in the intercostal muscles. Maybe you recognize some fatigue happening in these muscles. That's good. It's what we're here for, right? All right, we're going to end today's session with just one more exercise. It is just a recovery exercise, very simple. I invite you to take your hands like this, make a C and then a backwards C, cup them around your rib cage, relax your shoulders. We're going to do some slow breathing now, and I want you to hopefully feel the expansion outward and around with the rib cage with the inhale, and feel the contraction back down on the exhale. Breathe in through the nose, feel the expansion. Exhale through the nose or the mouth. Feel the rib cage collapse back down. Inhale. Exhale. Inhale. Think through the nose, slow and low. On the inhale, if we lose the six pack, that means you're doing it right. Exhale, let it go. One last breath together. Inhale, feel the air pass through the nose. Feel the expansion in the rib cage. Exhale, let the breath go. Relax. When you're done with that exhale, go ahead and relax your hands back down to your sides. Take a few normal breaths just to get back to it. I want to thank you all so much for joining. This is the conclusion of today's breathwork training session with me, Coach Anthony. Once again, our programs here at Recal have helped people train, hundreds of athletes train for their big mountain endeavors, whether that was a race or an expedition of some kind. Today's session was all about strength training. That's important because when the air gets thin, breathing gets harder. We need to train those muscles to take on the extra load in that thin air. I invite and encourage you, if you're interested, to join one of our training programs. We have three different options, whether that's the self-guided plan, the online video course, or a personalized training plan with me. Those are your three options. You can always enlist me as your coach for your breathwork training to achieve whatever goal you have on the mountain. Thanks so much for joining today's free Monday morning breathwork training session. I look forward to seeing you again next week, which is when we'll cover the E, all about elevating your performance, actually integrating it into your training plan and taking you to greater heights on the mountain. Thanks so much, everybody. Have a good week. See you next week. Bye.